Hey, what's up, guys? Happy Friday. Thank God it is Friday, TGIF. Huge. So today my topic about nursing, I'm keeping with the nursing theme, is what do NPs and nurses, but what does a new NP carry in her bag? And look at this thing. This is my huge bag. And actually, I used to carry this bag around when I was a nurse, too. And some of the things have stayed the same, and some of the things have changed. So first and foremost, I always carry my stethoscope. So I've got to have that. Got to have that if you're going to be working, right? So your stethoscope. I usually carry my lunch with me too. So I usually have the whatever I'm going to eat for the day. And then I carry my daily calendar, so I can put all my stuff in so I can try to stay organized type of thing. So between schedule changes and things like that, basically I also have a pharmacy in my backpack. In my bag. I always make sure I have Excedrin migraine because I'm a migraine person. And then this is gonna seem weird, but I always have my beeper, and I have my pen light. I have my pens that I need to carry. Of course, I have my name badge. I usually have a little bit of makeup. Sometimes I have a little powder puff because you never know when you're gonna get a little shiny. And then so that's my personal stuff. That's stuff that I used to carry as a nurse. And also lotion, because your hands get freaking dry when you're washing them every 2 seconds. But now that I've kind of graduated and became a nurse practitioner, some of the things that have changed for me and that I bring also is, I have a bunch of quick references, reference books that I use. So this one right here is the Maxwell Quick Medical Reference, and it's kind of cool because it gives you a quick little outline of notes that you need to write, if you're doing a history and physical on, an ICU patient versus an OB patient, or if you're if you're doing an admission, so it tells you what to put in for your H&P, which is your history and physical, versus a progress note. It gives you different lab ranges that are normal or not normal. I used this a lot when I worked in neurology. This is it tells you all about the optic nerves, because if you're anything like me, sometimes you forget some of your optic nerves. And yeah, even working in neurology for 8 months, sometimes I would forget. So it's always nice to have this. You can stick it right in your pocket too. Talks about the Glasgow Coma Scale, the dermatome maps. I really like this one. And actually I bought this one because one of my clinical mentors had it and I really enjoyed it. So this is the one that I carry around with me. Now that I work in critical care, I actually have this book that I bring with me, and it's Acute and Critical Care, and it's written by NPs, and it actually goes into real, true cases that you would see in any kind of an ICU, whether it be a surgical ICU, a medical ICU, not pediatrics because I don't do pedi, and it goes over certain examples that you might see, and it talks about basically from your history taking all the way through your diagnostic to your differential diagnosis to what your plan would be and your assessment. So it's pretty cool. So I like this one because it's very much based on ICU. Then with that being said, I also still carry around this little thing right here. And as you can see, I use a lot of the references. So, as I am a nurse practitioner almost a year out, I still use my reference books all the time. And I don't find anything wrong with that because I feel there's a huge learning curve, just like nursing. I do truly feel there's a 5-year learning curve. And I think that when I became a brand new nurse, I didn't really feel comfortable with myself in any situation. I felt comfortable and more confident, but I didn't feel like I could handle any situation until about my 5-year mark. So I got 4 more years to go until I can maybe feel somewhat confident as a nurse practitioner. Because, it really is true. You go from being a novice to an expert back to a novice. And sometimes it can be a little disheartening because you're oh my God, every day I feel I'm stupid. I feel I don't know what I'm doing. I know that's not really true, but sometimes you can feel that a little bit. So this is the book that I used to study for my boards. It's Fitzgerald, and actually she's a DNP, like myself. and I think she was like probably one of like the first DMPs, and she's pretty local. I think she's in Boston. I think she lives, or this class I took was in Boston, but I think she lives like locally, like in Massachusetts. And she has a nurse practitioner group online that I'm also in, and she gives feedback all the time. She's in it, and she's very involved, very much advocates for patients, and very much advocates for nurse practitioners, and especially doctoral. Like, she encourages people to get their doctorate in nurse practitioner. So this book is like my savior. As you can see, all of my little stickies. And the other thing that I use now that I work in critical care is I have a binder, which I can't really open, but because it has like patient information in it. But I have started a binder, and what I do is every day I have to keep like a log with patient stickers and every procedure that I do, because at some point, you know, when you start an intensive care unit, you have to get credentialed in like more invasive procedures like central lines, arterial lines, intubation, chest tubes, things like that. So you need proof that you've actually performed these procedures. So it's a great idea to keep an accurate log, and, you know, check off like what procedure it was, what the date was, who your attending physician was, and that kind of stuff. So I think you have to have at least 10 procedures before you can actually be considered credentialed as a nurse practitioner in the unit at the particular facility that I work at. So that's, and somebody actually taught me that recently, so I wasn't doing that before, and that's a really key thing so that you can keep organized. I also have like cheat sheets in here, like for things that I'm like always kind of looking up, algorithms and things like that. You know, like what would I give this person for this diagnosis? What's the starting dose of medication? And yes, you have like pharmacy and things like that, but they're not always like sitting right next to you. And sometimes, you know, you feel like you should be doing some critical thinking and some brainstorming on your own. And then the other thing that I use quite often, but I am video recording this on my phone, so I can't show you, but I use a couple of apps. One of them is called Epocrates, and I love Epocrates. And for the most part, I feel like it's pretty accurate, and that's a medication. Like, you can look up different medications, and you can like compare for like any kind of interactions or side effects. You know, talk about if it's like renally excreted, liver, whatever, like contraindications, black box warnings, and stuff like that. So I use that actually on a regular basis. It also has like calculators on it, so like you can calculate, you know, like what doses you should be giving people and things like that. It has a calculator for like adjusting like tidal volume on a ventilator, because, you know, I can't do things in my head. And then also Up to Date. You can get the app on your phone, but you can also register it through your job. So every time you look at something on Up to Date, you actually get CEUs or CMEs. As a nurse, I think they're called CEUs. As like an NP or a PA or whatever, I think they're called CMEs. And so you have to have so many every time that you renew your license, just like in nursing. So I definitely use that a lot, because you get credit for that as well. And the cool thing about Up to Date is it keeps track of like your history, like your search history. So like if you're like, oh, I looked that up and I forget exactly what the recommendations were, you can always go back, because it's still in your file of what you looked at recently. And then of course, if you have friends who are like geniuses like I do, I tend to text them every now and then and say, hey, what would you do for this? Hey, and actually I did it today. So I do it sometimes, you know, so it's always nice to have people in the medical field that you can bounce stuff off of, because ultimately, you know, we're all learning stuff, we're all human, and you're not going to know everything all the time, you know, especially as a new NP. So, you know, if you guys are out there starting off new, even as a new nurse, you know, definitely read books, bring resources with you, talk to people, and just try to stay organized. I would say that that's probably a key thing to being successful, is stay organized and just keep track of stuff. You know, if you find something that's really beneficial to you, you know, make a little binder, like it's just a small, like 1-inch binder, and keep track of it. So that's my little short and sweet spiel today. Hopefully somebody gains a little bit of insight by my video. I think I might be running out of topics to talk about as far as nursing. So I think, you know, I'm going to probably go back to my thyroid stuff in, next week. Unless you guys have any questions, you know, feel free to ask, and I would love to answer them. All right, I'll talk to you guys later. Bye.